Hey everyone, Dr. Raval, 35 years as a practicing physician and author of the Physician Practice Blueprint, a book I put out there to regain physician autonomy, which is what we're going to be talking about today. In 2022, about 108,000 physicians left private practice. And among the largest reasons cited is decreased reimbursements by insurance companies, a lot of physician debt as young practitioners come into the market, and skyrocketing operating costs. So these are three factors that caused it. What's happened is 46% of all physicians right now, maybe higher, are employed by big corporate models. So employed physicians are largely corporate, and so all the clinical decision making is going to financial profit making by these corporations. So if you're employed by a company, whether it's a big hospital system, a lot of pharmacy systems now, or a multi-specialty practice that's corporate run, the priority for this corporation is financial, and it is to make themselves a profit. It has nothing to do with the factors that perhaps brought you into medicine. So many physicians now, having taken these positions, are trying to get out. They are bound by non-compete clauses, and there's a lot of legislation to fight that. But they are at the whim of these corporate factors, meaning how much time you spend with someone, who you send that patient to, and whether cultural issues may determine care. It is the loss of autonomy for a well-trained physician is the biggest concern of any physician taking these positions. They lose their ability to influence patients and to make decisions for their care. And there's also decreased time with these patients. So what's happening is, a couple years into this now, 3-4 years, we're seeing physicians trying to get out of these systems. It is not the be-all and end-all. And so these 3, 4, 6 years perhaps are wasted working for someone else and giving them the best of your years when you could be starting your own practice. So I'm here and have written the book to provide this blueprint so that you could make it happen. And there are ways to make it happen very easily. A lot is controlled by software, and we can make software systems now work for us. So, just some quotes recently from a lot of my physician friends. I'm a practicing podiatrist, but number one, when you're in private practice, you get to send your patient to whichever hospital you feel is best for that patient care, not the hospital that you necessarily work for. Number two, if it's cultural, like I have a lot of Indian patients and a lot of Asian patients, a lot of them are comfortable going to smaller hospitals within their neighborhoods versus large hospital systems. I get to do that. I also get to direct their care, meaning if I have to spend 20 minutes on this patient and 15 minutes on that patient's going to get my 20 minutes if I can provide multiple services at the same time. You still have to make it through your day. You still have to schedule patients the way you see them, but it gives you a lot of autonomy. So erosion of physician autonomy, the one thing that is bringing physicians out of these corporate systems, and for the reasons we talked about, one of the reasons you may not be happy. So if you are contemplating building your own brand, this is my book. Available on Amazon, and I hope that helps and makes you look at things a little bit differently.